Hey guys, Dr. Ben Galliard here, author of the book, Rebuild Your Brain, Stop the Damage, Start the Repair. Just wanted to go over a couple things today. I get a lot of questions as I'm reviewing blood work, doing report of findings on what is actually going on in people, and we talk about inflammation, and we talk about a connection between inflammation and blood sugar. Blood sugar can contribute constructive or destructive, and so it can, if we have elevated glucose, that's going to cause an insulin response and it's going to cause inflammation. And so a lot of people, they're like, well, how does that really work, and how is it really correlated together? And what we look at is there's usually inflammation. We think of, oh, my joint is swollen and I've injured it and I've got inflammation, swelling, you can see it from the outside. But what happens on the inside, on that cellular level, that's when we get the true damage, the true inflammation. And that's why they call Alzheimer's type 3 diabetes now, because we're creating this inflammatory cascade inside of our body, and the blood sugar is a big reason that we see that. So it's going to create cytokines, it's going to stimulate TNF-alpha, interleukin-6, a bunch of these different inflammatory products in our body that are going to contribute to damage. And it's going to cause people to start breaking down nerve cells. One of the things I always look at is neuropathy. People talk about diabetic neuropathy. We've got damage in the feet and damage in the hands. They can't feel it. But what is actually going on there? Well, we're destroying nerve cells, that elevated glucose, elevated insulin, and we're destroying those nerve cells. So it's not a far stretch to say what happens when we get elevated glucose and damaging our brain. It's going to start destroying and damaging a bunch of those nerve cells in the brain. So balancing the blood sugar, this is actually going to be my next book that comes out, is going to be a huge component of our health and of downregulating and calming that inflammatory cascade. That's why almost every patient that comes in the office, we have them start by testing their blood sugar and checking it at various times throughout the day. We need to know, why is that blood sugar going up and why is that blood sugar going down? Some people, sweet potato is worse than white potato, even though you read that sweet potato is supposed to be good for you. Or oatmeal is supposed to lower cholesterol, but it actually makes the blood sugar go up, and that makes the cholesterol go up. So all these different things we need to know before we can say, hey, eat this diet or eat that diet, because it's such a impactful thing if we can stabilize that blood sugar. So elevated glucose, elevated insulin is going to drive inflammation, especially on that cellular level. You may not see it in swelling in the joints, but you're going to see it in degeneration in the brain cells. It's going to cause inflammation in our blood vessels, can contribute to heart disease, all types of different things that we've got to figure out why that blood sugar is being affected, what foods are causing the problems, and what we can do to help that blood sugar. So if anybody has an autoimmune condition, has diabetes, has an inflammatory condition, has cardiovascular disease, there has to be a component to blood sugar with that. And so that may be 10%, that may be 90%, but we've got to come through and correct those. If anybody you know is dealing with these, hit like or share on this video and it'll post out there, because it is such an important concept that most people miss totally. So they may read, oh, follow the glycemic index, or check your blood sugar fasting first thing in the morning, or check your hemoglobin A1C. Those are all good and a nice place to start, but that does not give us the whole answer. We've got to take that step back. We've got to come up with that solution of why it's going up, why it's going down, that individualized diet plan. And pretty much any inflammatory chronic condition that's going on, the blood sugar is our foundation. We call it our deal breaker. If somebody's not willing to figure out what's going on with that blood sugar, if they're not willing to track their food, we're not going to get the results we want. And frankly, we're not going to start care with that person, because it's crucial for them to be able to get those good underlying information. Let's come up with that solution, come up with that game plan of why it's contributing to these imbalances in the body. Once we figure that out, that body's going to be in way better shape, a lot less inflamed, and a whole lot better state of health. So if you guys have any questions at all, feel free to leave a comment. You can also get a hold of us, telephone, email, share this, like this, and we love getting the word out there, especially with these chronic conditions and what this blood sugar is going to do to the brain, to the inflammation, everything in the body. So if you have any questions at all, drop us a line. Otherwise, I look forward to talking to you soon.